The standard treatment for Hashimoto's thyroiditis is fundamentally flawed. It only addresses the symptoms while ignoring the actual autoimmune attack on your thyroid. For decades, doctors have prescribed Synthroid and other thyroid replacements without addressing why your immune system is attacking your thyroid in the first place. By focusing solely on hormone replacement, traditional treatments allow autoimmune destruction to continue unchecked, potentially leading to complete thyroid failure and persistent symptoms like brain fog, fatigue, and weight management issues, even when your TSH levels appear normal. Stay with me until the end of this video to learn about a promising alternative approach that may help address the root cause of Hashimoto's and how it could complement your current treatment plan. Hello, I'm Mark Filosi, a compounding pharmacist with over 35 years of experience and part of the team at RxVIP Concierge Quality Pharmacy. Throughout my career, I've been dedicated to finding effective solutions for complex health conditions that traditional approaches often fail to fully address. If you're one of the millions living with Hashimoto thyroiditis, or you're caring for someone who is, you know that despite taking thyroid medication faithfully, troublesome symptoms often persist. You've probably done your research, tried different dietary approaches, and maybe even worked with a multiple specialist, yet still struggle with fatigue, brain fog, weight fluctuations, or hair loss. Today, I'm going to share information about low-dose naltrexone, or LDN, a promising approach that's generating significant interest among functional medicine practitioners and patients with autoimmune conditions like Hashimoto's. You'll learn how it works, why it's different from conventional treatments, and whether it might be worth discussing with your healthcare provider. Research at Penn State University has shown that low-dose naltrexone helps modulate the immune system and reduce inflammation in autoimmune conditions by temporarily blocking certain receptors, which ultimately leads to increased production of endorphins and enkephalins, your body's natural immune regulators. Low-dose naltrexone works differently than conventional treatments. At standard doses, naltrexone is used to treat opioid and alcohol dependence, but at much lower doses, typically 1.5 to 4.5 milligrams, it has immune-modulating effects. When taken at bedtime, LDN briefly blocks your opioid receptors for a few hours. This temporary blockade triggers your body to produce more of its own endorphins and enkephalins, which play a crucial role in regulating your immune system. For Hashimoto's patients, this may help calm the overactive immune response that's attacking your thyroid tissue. Unlike traditional treatments that simply replace the hormone your damaged thyroid can no longer produce, LDN aims to address the underlying immune dysfunction itself. This is fundamentally a different approach, treating the cause rather than just managing symptoms. Many Hashimoto's patients using LDN report improvements in symptoms that persisted despite having normal TSH levels on standard thyroid medication. These include reduced fatigue, improved cognitive function, better mood, and in some cases, reduced thyroid antibody levels. What makes LDN particularly appealing is its safety profile. Side effects are typically minimal and often limited to vivid dreams or sleep disturbances during the first week or two of treatment. There's no immune suppression as seen with many other autoimmune treatments, which means no increased risk of infections and no serious complications. Another significant advantage is the cost. LDN is an affordable treatment, typically costing between $100 and $150 per month. Compare this to biologics and other advanced treatments for autoimmune conditions that can cost thousands of dollars per month. For LDN to be effective, proper dosing and preparation are essential. This is where expert compounding pharmacies like RxVIP make a crucial difference. Standard naltrexone comes in 50 milligram tablets, but LDN therapy requires much smaller doses, typically starting at 1.5 and gradually increasing to around 4.5 milligrams. Some patients may find their optimal doses even more specific, such as 3.1 milligrams or 2.5 milligrams. At RxVIP, we precisely compound these customized doses in a variety of forms to meet your individual needs. Unlike some practices where patients are told to crush commercial tablets and measure their own doses, which is imprecise and potentially risky, we provide professionally compounded LDN in carefully calibrated strengths. We also pay careful attention to inactive ingredients. Many commercial fillers can trigger inflammatory responses in sensitive individuals. That's exactly what we're trying to avoid in autoimmune patients. Our compounding approach uses microcrystalline cellulose or other carefully selected fillers that minimize the risk of adverse reactions. We've created a free guide called Understanding LDN for Autoimmune Conditions that goes into greater detail about how this approach works, what the research shows, and what's discussed with your doctor. Visit rxvip.com to download it today. As I promised at the beginning, here's what makes LDN a fundamentally different approach to Hashimoto's. Rather than simply replacing thyroid hormones, LDN works to rebalance your immune system, potentially slowing or even halting the autoimmune attack on your thyroid gland. This means it could help preserve the remaining thyroid function while also addressing those persistent symptoms that standard treatments often fail to resolve. If you've been struggling with persistent Hashimoto's symptoms despite taking thyroid medication, I encourage you to visit rxvip.com to learn more about our personalized approach to compounding LDN and other integrative solutions. You can also schedule a consultation with our team to discuss whether LDN might be appropriate for your specific situation. Imagine what it would feel like to have more energy, clearer thinking, and to know that you're not just masking symptoms, but actually addressing the root cause of your condition. This is the potential that LDN offers for many Hashimoto patients. To recap, low-dose naltrexone works by modulating the immune system through increased production of endorphins and enkephalins. It offers benefits including improved symptoms and potentially reduces antibody levels with minimum side effects. And proper compounding is essential to ensure the precise dosing needed for optimal results. Have you tried alternative approaches to managing your Hashimoto symptoms beyond standard thyroid medication? Share your experience in the comments below or let us know what questions you have about LDN. Thanks for watching. Hit subscribe to get more medication management insights. Here's another video I think you'd like.